So for the most part, more than 65% of the patients who get a transplantation will survive long term. We're talking at 5 years. Allogeneic transplantation, which is one of the forms of bone marrow transplantation that we do, requires the donor to be somebody else. That's a situation where you either have a family member provide you, and it's usually a brother or sister. But as families are getting smaller, the chances of finding a match within your family are much less. So we have to go outside of the family. There is an international registry which has over 20 million adults and cord blood units that are available for these transplantation procedures. The more people that go into the registry, the better chances of finding a match for somebody else. People are sometimes concerned about what I have to do to be a donor on the registry. Well, there's no cost or fee to you to begin with. The obtaining of your tissue sampling is very simple. They just brush the inside of your cheek with a swab, and that's put into a tray, and that's sent off to be tested. You're able to get the DNA necessary from the cells on the inside of your cheek. So no blood is required. There's no pinching. There's no coercion either. This is actually a voluntary process. Now, once they type this, the cells from you, your information is put into an international registry. They will contact you only if they find somebody who is close enough matched to you genetically to do the procedure. And if so, they will call you in. At that time, they'll get some blood work, they'll do a history and physical, make sure you're an appropriate donor, and if so, then they will take you forward to the collection procedure. The collection procedure can be done in actually two different ways. The first way is a bone marrow collection. That's a minor surgical procedure that's done. It's done the same day. You come in the morning, you have the procedure under anesthesia, where we will go into the hip and draw out about 1 liter of blood and bone marrow. That does not have effect on you long term. Your body will replace that within 2 to 3 days, and you'll be back to fully functioning within a couple of days after the procedure. You will be sore, but your heart will be happier for having done the procedure. The other way to do it is called through apheresis, and there we will give you a shot of a drug that will help bring the bone marrow cells out from the bone marrow into the peripheral blood. And then on a special machine called an apheresis machine, the blood is collected about a cup at a time. It's spun down into sort of a parfait, and the creamy layer of cells there that contain the stem cells are skimmed off. The rest returns to you, so there's no long-term damage to you, and those stem cells, again, will replace themselves within a week's time. Once you're finished with that procedure, you go home, drink a lot of fluids, rest a little bit, but you'll be ready to go to work the next day without any problems. From the standpoint of getting sick after procedure, folks are not really in any harm's way. There's been a long-term follow-up study on patients or people that have been donors for other people, and there have been no untoward side effects to those folks. So it's a very safe procedure, it's easy to do, and you really get the benefit of doing a truly altruistic thing for somebody else.